How federal law, statutory law, policy institutes, and other stakeholders impact the Patient Protection and Affordable Care Act health policy formulation. This presentation provides a broad overview of Patient Protection and Affordable Care Act or PPACA and how federal laws, statutory law, policy institutes, and other stakeholders impact the health policy formulation, such as establishment of health benefit, expansion of publicly funded health programs, other major changes to the healthcare system, importance of short and long-term implications of PPACA for the state's array of health programs, and potential multi-billion-dollar annual cost of these federal mandates to the state. The Constitution on Health Care Policy. The federal government level has the limited ability to force states and individuals to take certain actions because the 10th Amendment of the U.S. Constitution, limiting Congress and executive branch to specific powers and reserves all other powers for the states. However, members of the federal government may use their enumerated powers such as to tax and spend to persuade states and others to act in desired ways. Constitution does not give the legislative and executive branches the power to protect the public's health, meaning this is primarily within the purview of the states to regulate. This slide shows how a healthcare bill becomes a law. The President has power to execute executive orders. Congress is tasked to making of laws under system of government. If Congress believes it is contrary to congressional intent, it has two ways to recourse. Number one, to amend the law to clarify its intent, and number two, effectively stamp out executive order that is clearly contrary to the law. The President may veto any bill. In effect, it takes two-thirds of the majority of the Congress to override an executive order. Congress may challenge executive order in court, claiming President's action exceed its constitutional powers. Opponents of PPACA may dislike this possibility, but it would be unreasonable for them to blame any judge who uses judicial restraint in relation to PPACA. After all, even restrained conservatives have a far greater interest in conserving the Constitution than do the legislators and the President who enacted PPACA. The most constructive thing opponents of PPACA is it can do to persuade the American people to elect more public officials who want to conserve the Constitution. The President and judicial power. A major impact of the court's decision is the 129 million people with pre-existing conditions and millions of middle-class families who will have the security of affordable health coverage. The Supreme Court upheld PPACA on June 28, 2012, stating the final ruling on PPACA was made by Supreme Court Judge Vinson. The ruling basic idea of PPACA was declared a tax and not a mandate, and therefore declared constitutional. Health institutes and interest groups. They do not have the power to make policy or healthcare policy. Their role is to try to influence the decisions of policymakers. They provide way to give a voice to members to participate effectively in policy-making process. The interest groups consist of the trade associations, advocacy groups, think tanks, and lobbying firms. Legislature must consider the state's role in implementing a federal healthcare law, address future healthcare costs by maximizing receipt of federal funds, leveraging the state's purchasing power, and reducing the cost of care for high-cost individuals. Structural changes to state programs are warranted. PPACA provides an opportunity for the legislature to re-examine the structure of the state's health programs going forward. The PPACA should prompt a re-evaluation of the state-local partnership. In light of the interactions between local government and state programs, it will be critical for the legislature to reassess the state and local relationship as part of its deliberations on the implementation of PPACA. New strategies could bolster healthcare quality and outcomes. The PPACA makes available grants and demonstration project opportunities to assist states in addressing certain problems in gradual manner. Future workforce and health infrastructure needs should be assessed. The individual mandate and expanded coverage options created under PPACA will likely create a surge in demand for healthcare services statewide. Successful implementation of PPACA will depend on the state's response to access issues including workforce and infrastructure capacity as well as the regional variation of supply of health care services. The PPACA formulation. The U.S. healthcare system is an interlocked network of patients, physicians, hospitals, insurers, employers, regulators, and other stakeholders. A significant change impacting one component will definitely reshape the entire system. The Healthcare 2010 reform made it difficult for Congress to navigate and for many people to understand. The confusion made it easy for reform critics to exploit consumers' fear. Healthcare reform has a series of 92 different provisions gradually transforming the complex system that drives 7% of the U.S. economy. The phased implementation of the law has 25 provisions implemented, including new taxes on pharmaceutical companies and lower prescription drug costs for seniors and individual mandate. While political opponents pursue a series of obstructions in Congress, the U.S. Supreme Court is expected to decide the critical legal challenge to healthcare reform. PPAC intends to make coverage more accessible. It creates an individual mandate requiring most U.S. citizens and legal residents to have health insurance coverage or pay a penalty. It establishes American health benefit exchanges, making coverage more accessible and affordable. PPAC creates new entities called American Health Benefit Exchanges through which individuals who generally do not have access to affordable employer coverage as well as small businesses can purchase coverage. Changes private health insurance coverage, establishes new requirements for health plans and insurers designed to expand access to affordable coverage and prevent individuals from losing coverage. It expands Medicaid program primarily by mandating coverage of certain population groups not previously required, such as low-income and childless adults. It establishes new high-risk insurance pool that establishes a federal high-risk health insurance coverage pool program to provide coverage to individuals who are unable to purchase coverage and who are commonly referred to as hard to insure or medically uninsurable. The strategic context of healthcare reform affects major stakeholders in healthcare delivery. Number one are patients. Patients believe the access provisions are taking effect by eliminating insurance restrictions on individuals with pre-existing conditions and allowing children to be covered under their parents' plan until they turn 26. The changes impact their care, their doctor, and their paycheck. The language of the reforms are not clear and the changes will be an ongoing communications challenge. Physicians believe there is a potential disconnect between the American Medical Association, which support the law, and its grassroots stakeholders. Physicians feel cheated by the rate and the scope of change. 26% of physicians states they would continue practicing the way they currently are over the next 3 years, and three-fourths of physicians state would retire, work part-time, stop accepting new patients, or look for a hospital-based clinical or administrative jobs. The growing movement toward accountable care organizations in the medical home model of care, a surge shortage of primary care physicians, and reduced consumer spending on office visits, diagnostics, and drug concerns physicians while trying to juggle the demands of patient care. PPACA affects major stakeholders in healthcare delivery. Employers believed the reform law's tax credit for small businesses was enticing companies with fewer than 25 employees to offer workers insurance benefits. Employers are turning to consultants to understand the law, comply with new reporting requirements, and communicate changes to employees. The law creates administrative burden to understand the 2,400 pages of documents. Insurers' reputation will continue to suffer beyond the withering attacks of politicians and consumer health advocates, but the new reform will put insurers in the best position to reap significant financial gains as implementation of the law generates new members and market opportunities. The United Health Group Incorporated added 75,000 new customers from companies with fewer 50 employees. Coventry Healthcare Inc. had enrolled 115,000 new workers in the first 9 months of 2010. Major insurers of plans capitalized on the nearly 40 billion worth of potential work managing Medicaid plans for individual state governments, which will oversee an expansion of the program beginning in 2014. An estimated 16 million new enrollees will join Medicaid. The way that insurers implement facets of the law for employers represents an opportunity to strengthen their brand and build customer loyalty. But it remains to be seen how the industry can rebuild its reputation with state and federal governments gearing up to implement facets of the law that empower regulators to scrutinize premium requests, impose rate hikes caps, and enforce staff new transparency disclosures. PPACA affects major stakeholders in healthcare delivery like hospitals. Implementation of PPACA caused an automatic reduction in federal reimbursements to hospitals. Revenues declined and reduced patient volume. Patient deaths piled up and costs rose due to increased new use of emergency care. Mass layoffs have cost more than 23,000 hospital employees their jobs as providers to reduce costs and increase efficiencies. Experts forecast more hospitals mergers, partnerships, and expansions. Providers will also try to win their share of 30 million new paying patients expected to enter the healthcare system in years ahead. Health providers nationwide are spending hundreds of millions of dollars on buildings, marketing, and new partnerships to position themselves to attract the future new customers created by the reform law. The impacts legislature will consider to address workforce development. As access to healthcare coverage expands to new populations, the demand for healthcare services will increase. It will be important to assess whether the current and projected size of the healthcare workforce, including for particular types of clinicians and for particular regions, it will be sufficient to meet demand. Some federal funds will be available for states and other entities to expand healthcare workforce, including student loan repayment and forgiveness programs as well as grants for enhanced training programs for a variety of healthcare professionals such as nurses and social workers. Health insurance oversight and regulation may create additional workload for the Department of Insurance and the Department of Managed Healthcare. The legislature will need to consider how its statutes and regulations governing health insurers and health plans align with these new federal rules, as well as the standard packages of benefits that are to be offered to individuals participating in health benefit exchange. The impacts of legislature will consider to address federal tax changes and state revenue impacts as PPCA imposes various taxes and penalties that may have an impact on businesses and individuals. These changes, as well as the expansion of health coverage, can have a significant implications for the state tax system and revenues. As more persons obtain coverage and pay premiums, state insurance and premium tax revenues could increase. The state employee and retirement benefits is to be considered as various provisions of PPACA, including some important changes to the federal Medicare. Conclusion: PPACA is a federal health care reform that changed the structure and availability of coverage. The scope of PPACA is so broad that it will be years before all of its provisions will be fully implemented and its overall ramifications fully understood. The federal government will promulgate regulations over the next few years that will clarify PPACA and give more detailed guidance on how many of its provisions are to be implemented. Finally, this will encourage legislature to think more broadly about the opportunities PPACA provides the state to improve the financial sustainability and structure of the state's health programs and improve healthcare quality and outcomes. The last page is the reference. My reference are 2010 PPACA, the Patient Protection and Affordable Care Act, an overview of its potential impact on state healthcare programs. I retrieve it from http://reports/2010health/fed healthcare/fed healthcare 051310 ESPX. My second reference is 2012, the policy and the policy making process, chapter 2, Jones and Bartlett learning. I retrieve it from files. The next reference is 2012 Obamacare Facts, Supreme Court Obamacare ruling on Obamacare. I retrieve it from http://obamacarefacts.com, supremecourt.obamacare. Then my next reference is KFSOE 2011, How Health Reform Stakeholders Will Be Affected by Recent Changes. I retrieve it from http://www.praz.org, intelligence / the strategist / view 9071/1028, and how health reform stakeholders will be affected by. My last reference is SLACE R 2016, Obama and the Limits of Judicial Conservatism, which I retrieve it from http://www.nationalaffairs.com, publications/data/Obamacare and the Limits of Judicial Conservatism. Thank you.